All right, I want you to look at this picture. Check out the bone on the left-hand side. That's what normal bone looks like. The one on the right-hand side has osteoporosis, and you can see, all of the circles and things of that are much bigger. It's kind of spongy. Osteoporosis is silent. It has no symptoms. It's something that you have to screen for with a bone density scan. All right, so if you have osteoporosis, you're more prone to breaks and fractures and things of that nature, and nobody wants that. So today we're joined by Stephanie Draker, Family Nurse Practitioner at Novant Health's Clemmons Clinic. So let's just talk about what osteoporosis is and who can get osteoporosis.
So osteoporosis is very common. It can happen to many, many people in our society, men and women. Osteoporosis means porous bone. So what happens as we get older, especially women more commonly, but it can happen with men, we tend to lose more bone than we make bone. So with that, the bones become more fragile. They're more prone to fracturing. And those fractures can be pretty hard on our health. They can limit our mobility, they can lead to disability. The commonality, there are 54 million Americans that are diagnosed with osteoporosis. 1 in 2 women greater than the age of 50 and 1 in 4 men greater than the age of 50 will actually suffer an osteoporotic related fracture.
And I think people think of osteoporosis and they think of somebody who's like 70s, 80s, that kind of stuff. But my cousins and I all got bone density scans at 50 and all showed that we were getting ready to have osteoporosis.
Yes. So interestingly enough, a lot of fractures actually happen before we progress to osteoporosis. First, you see osteopenia, which is the beginning stage of bone density loss. Women, more common in women, especially after menopause because of how estrogen becomes deficient. With women, we also have smaller bone structures than men, so that can play a role in it too. Women also go through a period of their life, or most women, where they experience pregnancy, breastfeeding, which can lead to that fluctuation in hormones as well. Men don't always go through a period of time like that. Usually there's a secondary cause of osteoporosis for men.
All right, and so it's called the silent disease. Are there any kind of warning signs or symptoms that we should be looking for?
Yeah, so osteoporosis is silent. There's not going to be a symptom per se that's going to cause someone to say, you know what, this is something happening within my bone structure. You may notice a curvature of your spine, specifically the upper part of the spine where you may feel that you're leaning more forward. You could have a sudden onset of back pain that would be concerning, especially in the lower or the middle part of the spine. Also, if you're noticing that you're losing height significantly, that would be a reason that osteoporosis could be of concern for
Okay,
someone.
we don't want it to get to that point. So what do we do right now to keep that osteoporosis at bay? What do we have to eat? What do we have to do? All that kind of jazz.
So what you want to do is be very well balanced with your diet. I know, we talk about that and looking at specific things for osteoporosis. Adequate calcium intake is very, very important. That can come through dietary intake, of course. There's not only dairy products are rich in calcium, they fortify a lot of our foods now. Plant-based milks, breads, for example, beans, different things that you can buy canned food-wise. Also, dark leafy green vegetables, so kale, collard greens, turnip greens, broccoli, bok choy, those are all just sources of calcium. And if you're not getting a good intake in your diet, recommendations for postmenopausal women is 1,200 milligrams. Recommendations for men aged 50 to 70 is 1,000. Premenopausal women is 1,000. That's when we would look at calcium supplementation.
Gotcha. And exercise is important. Like every woman over the age of 45, I'm seeing them post on their Instagram that they're walking with a weighted vest. So let's talk about weights.
Yeah, so weighted vests are actually a very trending thing in our society right now. There's nothing wrong with a weighted vest, but they may not be for everybody. So I want to point out it's important that patients talk with their providers to ensure it's a safe device because it's not an approved medical device. But women have smaller bone structures. If you're carrying around little weight-bearing exercise can come from addition of weighted vests and things like that. There's high-impact weight-bearing exercise, aerobics, jump rope, climbing, hiking, and then low-impact like treadmills, ellipticals.
Okay, so get out there, do some things, pick up those weights because we need to do that. All right, thank you for your time and expertise. If you missed any of this, it's going to be in the Two Wants to Know section of our website.